Doctors are now giving the green light to pregnant patients, while children under 16, not so much. They don't want them to get it just now. Our Brianna Ray Turner is live tonight breaking down the reasons behind this event.
Yes, good evening. Yeah, doctors are still getting questions about this vaccine. Now, two of those questions are, is the vaccine safe for pregnant women and children?
Can pregnant women get the vaccine? Dr. Elizabeth Ransom, Executive Vice President and Chief Physician Executive at Baptist Health, says two organizations point toward yes, that pregnant women and lactating women should get the shot.
In fact, some indications show that pregnancy in and of itself is a risk factor for a worse course of disease with COVID-19.
Which is why Dr. Ransom believes that it's important for pregnant women to get the vaccine. But she understands why some pregnant women may be uneasy.
There's always a concern. Certainly, if someone is pregnant, no one wants to transmit something to their unborn child.
The vaccine trial for both Pfizer and Moderna did not actively recruit pregnant patients. They also didn't include children under the age of 16.
The recommendations are to administer the vaccines, Pfizer for those who are 16 and older, and for Moderna 18 and older.
Dr. Ransom believes the reason why children weren't a part of the study is because the process of a drug trial.
Anytime children are included in studies, it involves quite a bit more.
Now, if you plan on getting the vaccine and you are pregnant, Dr. Ransom recommends you go to your doctor first and then get your shot. I'm live in Jacksonville. Brianna Ray Turner, First Coast News, on your side.